Hello, everybody. I'm Dr. Annie Peters. I'm the Director of Research and Education at NAATP, and I'm here today with Dr. Holen Hirsh from OMNI Institute. She's the Director of Public and Behavioral Health. And OMNI and NAATP, we've been talking a lot together. We're both nonprofit organizations interested in social change. And I know Dr. Hirsh and OMNI work a lot with a number of NAATP provider members doing their outcomes research. And so thank you for joining me today, Dr. Hirsh. We're going to talk about a tool that you have created called the COVID-19 Impact on Addiction Treatment Survey. If you could just tell us a little bit of the basics about why you created this tool, why you think it's important, particularly at this time, and what it measures.
Yeah, great. Thanks for the invitation to talk with you today. So like Dr. Peters said, I work with the OMNI Institute. We're located in Denver, Colorado, and we work with a number of addiction treatment providers on their outcome measurements programs. And over the last many weeks, I've been having conversations with our partners about the desire to better understand the impact of COVID-19 on patient outcomes, and particularly with the rapid transition to telehealth and some of the other changes that have naturally occurred as a result of the pandemic and the current situation with stay-at-home orders. So we felt like one way that we could help support our partners and the broader treatment community would be to develop a short measurement tool to collect data systematically on the impact that this situation is having on people who are currently receiving treatment for substance use disorder. The survey is short. It's designed to take 10 minutes to complete. It focuses on 4 key topic areas: telehealth, AA or peer support meeting attendance, so current attendance, as well as a comparison to past meeting attendance, access to medication, and recovery capital. And then we do ask just a brief question about current substance use. The survey has traditional survey items as well as some more open-ended items so that we can capture the depth and richness of the unique individual experience of the current pandemic. I think that that's something we're really interested in and attuned to the fact that the impact is really different depending on people's unique circumstances during this time. So like I said, it's really short, it's easy to complete, and it's something that we are offering to NAATP membership as well as the broader treatment community free of charge as a learning opportunity.
Yeah. And so, having seen the survey, it, as you mentioned, those 4 topic areas, it really looks at how is COVID-19 impacting you and the client and your use of substances and your wellness and your, as you said, recovery capital, and also how is telehealth impacting you? How is the transition if you're using telehealth? It asks that. And what's helpful about it, what's not helpful, how do you feel connected, things like that. So really this data will help providers understand how are clients doing, which we want to know, how are we connecting with you, how is this helping you, and what's most helpful to you, the services that we're providing at this time. And then, as I understand it, the data is collected for a single provider or a group of providers, and then you're able to send back and say, here's the aggregate, it's all de-identified, it's or confidential, I should say, and that then they get a report that you also mentioned is free of charge, and which is awesome, that providers can see how their clients are doing, how they're responding to telehealth and to COVID.
Yeah, absolutely. So just briefly on logistics, Dr. Peters is going to provide a link in this interview where you can sign up if you are interested in participating. Logistically, we will then, receive notification that you're interested in participation. We will create a unique survey link for your organization that you will then distribute to participants. So you will select the clients who you would like to participate, as many, all of the folks who you're currently serving in treatment, and then we will collect data on our end and like Dr. Peters said, create a report that will be completely confidential on the part of participants. We don't collect any big identifying information. There are a couple of key demographic questions, but they are optional, and in no way is this data going to be connected back to any, medical record or anything like that. completely independent. Everything will be kept confidential. And then, another aspect of this that we are interested in is if there is sufficient participation across a number of treatment providers, and there is the possibility of aggregating data across providers, so looking across a number of providers and pooling the data together, that is something that we are interested in doing. We would, of course, ask permission for those who would want to participate. The opportunity would be then that each provider organization participating would be able to look at their data, relative to a larger group of providers. So if that opportunity does exist, it will depend on participation. That's something that we would be interested in pursuing.
Okay, so you're not going to compare treatment center A to treatment center B and say, oh, here's how these treatment centers are doing. Essentially, the purpose here is to help the provider understand the impact, and then also to say, how is the impact on my clients different from this aggregate of other treatment providers and what they're experiencing. And if you see things like, oh, our responses around telehealth are not as good as this aggregate, then maybe I need to make some changes or something like that. But that's not something you would be publishing of the specific treatment centers. That's
no,
just
absolutely not.
Individual treatment center.
Yeah, exactly. I think this exercise is really done in service of learning, and to the extent that we are able to help individual organizations make programmatic changes or improvements as a result of understanding their own data and possibly understanding their own data in the context of a larger data system, that would be of interest.
Wonderful. Well, this is a really great opportunity, and thanks so much for providing this and making this accessible to NAATP members.
Absolutely.
We're hoping that we get some providers to participate so that we can look at this impact, because we know that this pandemic is really profoundly impacting people, and people with substance use disorders are struggling, and we want to figure out how we can help them better.
Yeah, absolutely. Thank you.
Okay, thanks so much.